Hi, my name is Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. I continue to hear the following statement. I have a herniated disc in my neck or in my back, and therefore I must require surgery. I want to share an example or a story with you. If there are 100 people in a room and they all have herniated discs, but they don't know it, 50% of those people don't have symptoms and would never think to have surgery or to see a physical therapist or to seek out any type of treatment because the herniated disc is not impacting their life and their ability to do or not to do things. Now the other 50% of the people, they have pain. And when they find out they have a herniated disc, sometimes they do think that they require surgery. Except it's not always the case that they automatically will require surgery. For example, some of the symptoms that a person with a herniated disc may exhibit are numbness, tingling, pain, sharp shooting pain, or the feeling like their arm is going to sleep or their leg is going to sleep. Well, these symptoms can be exhibited because of a herniated disc. And what exactly is a herniated disc? A herniated disc is kind of like a jelly donut. If the jelly in the donut starts to squeeze out, that is what your disc is doing in your spine. The gel-like material in the center of that firm substance starts to push out, and it can create inflammation. It can also start to pinch on nerves, and then that sends symptoms down your arm and down your leg. Sometimes though, that herniated disc, the jelly is pushing out, but it's not all the way out of the donut. And because some cases are like that, it doesn't really cause symptoms. The reason that somebody's having symptoms are due to something else. That something else causing the numbness, the tingling, the pain, the sharp shooting pain, or the feeling like the arm or the leg is going to sleep could actually be muscles that are really tight and pinching on the nerve. A perfect example of this is the gluteus minimus muscle. That muscle is in the buttock region. When there are trigger points in the gluteus minimus muscle, it will actually mimic sciatica. And a lot of people will relate sciatica to a herniated disc as being the root problem, when the actual cause of the problem is you have a tight muscle in your butt. Now, if you have a tight muscle, it doesn't mean you have surgery. It means you go in and you work out the trigger point. And what exactly is a trigger point? A trigger point is when a muscle shortens. So if you have a muscle and its normal length is this, and it starts to shorten, this section here that is shortened has a trigger point in it, or can have a trigger point in it. And you have to have a physical intervention through medical massage, which is what I do with precision neuromuscular therapy. And I break that up and I help to restore the normal length of the muscle. If that is not restored, then when your muscle tries to shorten to do work and then lengthen to relax, it can't do it because that trigger point is in the way. So every time you try to do work, that trigger point shortens even more and it never restores back to its normal length unless there's intervention to break the trigger point up. That trigger point, if a nerve is passing through that trigger point, will pinch on the nerve. And the nerve does not like to be compressed or squeezed, and it does not like to be stretched. This is why sometimes people say, oh, when I stretch, it hurts and it makes my numbness, my tingling worse. So I don't want to do any stretches. Well, the reason is you potentially have a trigger point that when you try to stretch it out, you're actually trying to stretch the nerve too. And nerves don't like to be stretched and they don't like to be pinched. But once you release that trigger point, the symptoms can go away. That specific type of numbness and tingling or sciatic-like symptom would not require surgery. It just requires for that muscle to start to learn again to be at its normal length and to be stretched out without stretching the nerve, but allowing the nerve to glide alongside the muscle so that it can move the way you want those muscles to move and the way you want your leg to move. The piriformis muscle is also a butt region muscle, and it goes from your sacrum out to your hip bone or your femur bone at the greater trochanter, getting a little technical here. But the sciatic nerve actually, and 33% of the people will go above the piriformis muscle, will either pierce through the piriformis muscle, or will pass under the piriformis muscle. That, when that sciatic nerve gets pinched because of a tight piriformis muscle, it can also mimic sciatica. And if somebody goes to a physician and they see that they have a herniated disc through diagnostic testing with X-ray, MRI, then people will sometimes conclude that the herniated disc is causing the sciatica, when really, again, it's a tight muscle that is creating the symptoms. A similar example can be seen in the neck. Our neck muscles work to keep our head upright. When we don't have good posture and we slump forward, our neck muscles have to work really hard to keep our eyes in line with the ground. That's our main job. Nobody wants to be walking around like this, so we lift our head up. And when we lift our head up, we pinch our discs and we pinch other structures in our neck because we can close up the space and not allow the nerves to come through the space cleanly. What did I say before is that our nerves don't like to be pinched and they don't like to be stretched. But if we stand like this or we sit like this on a computer, then that is exactly what is happening. What does a person feel over time when they're like that? They feel numbness, tingling, their hands going numb, and it can often be mistaken for carpal tunnel syndrome when it's really a posture issue. Again, a person will go into the physician and they will say, oh, I have numbness and tingling in my arm when I'm sitting at the computer or when I'm holding my smartphone. And the physician does diagnostic testing and finds a herniated disc. And they think that the herniated disc is the problem. And it could very well be the problem, but if we don't correct the posture and open up the space in the chest and open up and stretch these neck muscles in the front and strengthen the muscles in the back, even if the person has surgery, they're not going to correct the problem or the root cause of the problem that perhaps even caused the herniated disc, but also may be causing the numbness, tingling, sharp shooting pain down the arm, and the feeling of dropping items or the feeling of the arm going to sleep. So as you can see, there are many factors that can influence nerve-related pain, that numbness, tingling, sharp shooting pain, or the sensation of an arm or leg going to sleep. It doesn't have to be the herniated disc that's causing the problem or those symptoms. It could be inflammation from being irritated from posture positions. Besides inflammation, it could be muscle tightness, pinching on nerves, and it could be postural positions themselves where we're just putting ourselves in a bad position that our nerves don't get the space they need to actually be able to do the work and send the signal to the muscles to do the work they need to do. I hope this has been helpful to anyone out there who is experiencing numbness, tingling, sharp shooting pain, radiating pain that's going from their shoulder into their hand or from their back or buttock region into their foot. And I hope this has been helpful to show you that surgery isn't always needed. Surgery is sometimes needed if somebody is experiencing drop foot, where they can't lift their foot up and their foot is dragging. That is definitely a reason to seek a physician. The other reason to seek a physician for nerve-related pain is if you lose bowel or bladder function. If you are not able to control when you go to the bathroom, that could be related to your back, and you want to go see a physician immediately. For your arm, if your arm has that sharp pain down it, if you can't move your arm, it's just hanging limp, that would be another reason to immediately seek a physician consultation and to call a physician, or even in some of those cases go to the emergency room for. But for position-related numbness, tingling, radiating symptoms where you are walking and your leg is going numb, you're standing, you can't stand for more than 5 to 10 minutes, your leg is going numb, or you can't sit at your computer for more than 10 minutes, or your hands go numb, or you're starting to get pain down your arm. These could be posture related, they could be inflammation related, they could also be muscle related, and they could also be herniated disc related. I hope that this has been educational for you and information has provided good information for you to make the best decision you need to move forward and seeking help. I would love to have a conversation about your symptoms and help guide you along the way. If you would like to touch base with me, you can reach me at Jeanette at 𝗍𝗵𝘆𝗀𝗛 You can call me at 262-842-2220, or you can check me out on my website at www.𝗍𝗵𝘆𝗀𝗛.com. Thank you so much for your time today, and I look forward to having that conversation with you if you have questions. Have a wonderful day.